Hello everyone, I'm Dr. Sushant. I'm going to talk about the bone clavicle. The clavicle is one of the bones of the pectoral girdle, the other bone forming the pectoral girdle being the scapula. So before I talk about the clavicle, I would like to tell you that I'm not using any sophisticated software to reduce the background noise. So please excuse me for the background noise that you might hear. So talking about the clavicle is also known as the collarbone. So the bone highlighted in green color now is the clavicle. The bone that you see lying behind it is the scapula. So the clavicle and the scapula together form the pectoral girdle. So in today's class, I will be focusing only on the clavicle. The other names for the clavicle are the collarbone. It's also known as the beauty bone. So the clavicle is one of the first bones that you will study in first MBBS. So it's also known as collarbone, all right, and it's also known as the beauty bone. Now the clavicle is actually present in mammals which use their upper limbs for prehension, right? And there is no homologous bone in lower limb, a bone that is homologous to clavicle in lower limb. Now let us start with the functions of the clavicle. The clavicle bone is a very important bone. So it performs certain important functions in our body. First of all, it acts as a strut. So by its strut action, it keeps the scapula away from our body so that the upper limbs can be freely moved. So the upper limb can actually freely swing clearly away from the lateral thoracic wall because the clavicle acts as a strut. Secondly, the clavicle actually transmits the forces from the upper limb, or we can say that it transmits the weight of the upper limb through something called the coracoclavicular ligament. The coracoclavicular ligament to the axial skeleton. Which part of the axial skeleton? To the sternum. To the sternum of the axial skeleton. So it basically transmits, the clavicle basically transmits the weight and the force from the upper limb through the coracoclavicular ligament, and also through the medial two-third of its shaft to the actual skeleton. Also, the clavicle presents a curvature which is convex anteriorly in the medial two-third and concave anteriorly in the lateral one-third. So this concavity that lies posteriorly, that is posterior concavity, anteriorly it is convex in the medial two-third and is concave posteriorly in the medial two-third. So this concavity basically offers protection to various neurovascular structures at the root of the neck. So neurovascular structures such as the great vessels of the neck, internal jugular vein, the subclavian vein, the subclavian artery, the trunks of the brachial plexus, etc. So all these are offered protection by the concavity present on the posterior surface of the medial two-third of the clavicle. Also, the clavicle helps in the various scapular movements. Right. So these are the basic functions of the clavicle. Now let us talk about the peculiarities of the clavicle. Right. The clavicle is a special bone. So the speciality of the clavicle is discussed under this topic, the peculiarities. So I've already shown you the bone clavicle. This one right here, this is the clavicle bone. As you can see, this bone is actually between the appendicular skeleton, which is formed, which is the bone of the upper limb, and the sternum, which is the bone that you find in the central axis. So the axial skeleton. So it is actually connecting the appendicular skeleton with the axial skeleton, through which it transmits the weight of the upper limb and the forces into the axial skeleton. And also you can see this curvature here. So it is convex anteriorly in the medial two-third and it is concave anterior in the lateral 1/3. So we have so many neurovascular structures at the root of the neck. We have the veins, we have the arteries. So as you can see, these arteries here, these large arteries, the subclavian vein, we have the interjugular vein, we have the formation of the brachiocephalic vein, we have the subclavian, this one right here is the subclavian artery, and we have the cords of the brachial plexus. These are the trunks of the brachial plexus. So these structures are actually protected by the posterior concavity of the clavicle. Right. Now coming to the peculiarities. So what type of bone is clavicle? The clavicle is actually a modified long bone. So why it is a long bone? Why is it a long bone? Long bone because it has got ends. Basically 2 ends are there and shaft. So why it is a modified long bone? So I will tell you why it is a modified long bone. So we know that long bones are bones which have 2 ends and a shaft, intervening shaft. Right. So the clavicle has got 2 ends. The 2 ends of the clavicle are, one is called the medial end, which is also known as the sternal end because it is going to articulate with the sternum. And the other one is the lateral end because it is going to articulate with the acromion process. It is known as the acromial end. So in between the 2 ends, it has got a shaft. All right. So here, let us take a look at the ends of the clavicle. Here, this is the clavicle. We can see. So the curvatures can be seen. So this end, the end I'm going to show you now, this end is the medial end. This is expanded. It is somewhat quadrangular in shape and it is going to articulate with the manubrium of the clavicle to form the the sternoclavicular joint. So this is the medial end. The lateral end of the clavicle is flattened from above downwards and it's known as the acromial end because it is going to articulate with the acromion process of the scapula. It is very evident here. So this is the scapula with its process, the acromion process. So here is the acromioclavicular joint. This is the acromioclavicular joint. So this end is going to articulate with this end of the acromion process. So this is the acromial end of the clavicle. Anatomically, it lies laterally, therefore it is also known as the lateral end. And the medial end here, it is going to articulate with the manubrium, that is the superior piece of the sternum. So here you can see this is the sternoclavicular joint. So these are the ends of the clavicle. So let us talk a little more in detail about the ends of the clavicle. So the medial end, I already told you, it's called the sternal end. Now the medial end is actually going to give attachment to what is called the interclavicular ligament. Right, what is interclavicular ligament? So you can expect this the medial ends of the clavicle to be attached to each other by something called interclavicular ligament. So here we can see one half of the interclavicular ligament. In fact, the left half of the interclavicular ligament is highlighted in green color. This is the right half of the interclavicular ligament. So the meaning is understandable. The 2 ends, the medial ends, so the sternal ends of the clavicles are attached to each other by this interclavicular ligament. So one of the structures that is attached to the medial ends of the clavicle are the interclavicular ligament. Then the periphery of the medial end gives attachment to what is called the capsular ligament, or the fibrous capsule of the sternoclavicular ligament. So here is the joint, the sternoclavicular joint that's formed between the medial end of the clavicle and the manubrium of the sternum. So here is the capsule, this one right here. So the periphery of the medial end is going to give attachment to the fibrous capsule of the sternoclavicular joint. And we also have something called the articular disc. Here is the articular disc. This is the articular disc of the sternoclavicular joint, this one. So these structures are attached to the medial ends of the the clavicle. So the medial end is quadrilateral in shape, and it is therefore it is the expanded end. When you compare it with the lateral end of the clavicle, it is expanded, somewhat quadrilateral in shape, and is going to articulate with the manubrium of the sternum to form what is known as the sternoclavicular joint. Now when you look at the periphery of the clavicle, the periphery of the medial end is going to give attachment to the fibrous capsule. So what is a fibrous capsule? Any synovial joint, you see the joint is packed on the outside by this structure called the fibrous capsule. So the fibrous capsule of the sternoclavicular joint is attached to the periphery of the medial end of the clavicle. It also gives attachment to what is called the interclavicular ligament, and the articular disc of the sternoclavicular joint. So this is about the medial end of the clavicle. Now let us talk about the lateral end of the clavicle. So what you call the lateral end, otherwise the lateral end is also known as the acromial end, because it is going to articulate with the acromion process of the scapula to form the acromioclavicular joint. Now what are the features of the lateral end? The lateral end is actually flattened compared to that of the medial end, which is expanded quadrilateral. The lateral end is flattened, and it bears the articular facet. The articular facet for the articulation with that the acromion process of the scapula, and this end gives attachment to the fibrous capsule of the acromioclavicular joint. Right. So one more time, let us take a look at the medial end. This is the medial end. As you can see, it is expanded, and the lateral end is actually flattened. This is the flattened lateral end of the clavicular, the acromial end. So that's about the ends of the clavicle. Now coming to the shaft. So what is shaft? Shaft is the part of the clavicle that's between the ends. So now talking about the shaft. So the shaft is divisible, is actually divided into two parts. So let us draw a simple diagram of the clavicle with its curvature. So this is the sternal end. Here is a curvature of the shaft of the clavicle, and then it bends like this, and then it forms the acromial end. So this is the diagram of the clavicle. So here let us label the ends of the clavicle. Now this end is the medial end, and this end is the lateral end. Okay. Now the part between the ends is the shaft. So this particular clavicle is of left side. Okay, this is the left side clavicle. So how will you determine the side of the clavicle? I'll tell you that. Now when you look at the shaft, you can see there are two curvatures. Now we are going to divide the shaft into two halves. Okay, not halves, two parts. Okay, so this part is the medial 2/3, because this end is the medial end, so medial 2/3, and from here to here this is the lateral 1/3. So there is a curvature. This is convex, this curvature, this is convex anteriorly, as you can see, is convex anteriorly, and the lateral one third is concave anteriorly, right? So that's the difference in the curvature. So the shaft is, so how are you going to describe the shaft? It is convex anteriorly in the medial two-third, okay, and it is concave anteriorly in lateral one-third. So we are dividing the clavicle into three parts: the medial one-third, middle one-third, lateral one-third. So we are combining the medial and the middle one-thirds together, so that's how you get the medial two-third and the lateral one-third. The medial two-third is convex anteriorly, and the lateral one-third is concave anteriorly. So that's the curvature. So the junction where they meet, the two curvatures meet, it is actually the weakest point of the clavicle. So the fractures of the clavicle is most common along this curvature, meaning where the curvatures meet. Now let us first talk about the medial two-third of the shaft. So shaft, medial two-third. So the medial two-third of the shaft of the clavicle presents four surfaces, and the borders are rounded. The surfaces are separated from each other by rounded borders. So four surfaces are there. What are the surfaces? There is the anterior surface, there is posterior surface, there is superior surface, and there is the inferior surface. So let me now show you the different surfaces of the clavicle. So here is your clavicle. Now the medial two-third, as you can see, the curvature here, the medial two-third of the clavicle, it has got the surfaces. Okay, what are the surfaces? It has got an anterior surface, that's the front, the anterior surface. The surface that is seen from the front is the anterior surface. We see the anterior surface. Now when you just rotate it, we can see the posterior surface, right? That's the posterior surface of the medial two-third. And we can see the superior surface when we look at it from above, and when we look at it from below, we can see the inferior surfaces. So this medial two-third actually presents four surfaces: anterior surface, posterior surface, superior surface, and inferior surface. And these surfaces are continuous with each other, meaning there is no definite border which is separating the superior from anterior, anterior from inferior, or anterior from posterior, etc. So these borders are actually rounded, and all the surfaces are continuous with each other. So those are the surfaces of the medial two-third of the clavicle. Right. Now coming to the lateral one-third. When you look at the lateral one-third, it is flattened, isn't it? It's flattened, and it presents two borders and two surfaces. So the surfaces are, one is the superior surface and the other one is the inferior surface when you look at it from below. And when you look at it from front, it presents a sharp border which is known as the anterior border. So this is the anterior border of the lateral one-third. Similarly, when you look at the posterior aspect of the lateral one-third, you will see that there is also the posterior border. Right, now what are the parts of the lateral one? So this is about the medial two-third. Now the lateral one-third has got two surfaces are there and two borders are there. See, in the medial two-third, the borders are continuous with each other, meaning the borders are rounded, the surfaces are continuous with each other. But in lateral one-third, there are two surfaces. The two surfaces are, so the surfaces are superior surface and inferior surface. So how do you get the superior and inferior surface in the lateral one third? Because the lateral one third is flattened from above downwards. Above downwards, so compressed from above. So superior and inferior surfaces are there. The superior surface is separated from the inferior surface anteriorly by the anterior border, and the superior surface is separated from the inferior surface posteriorly by the posterior border. So these are the borders and the surfaces of the shaft. So medial 2/3 and the lateral 1/3. Please remember the medial 2/3 is cylindrical, isn't it? The medial 2/3 is cylindrical. That is how you get 4 surfaces, and the lateral 1/3 is actually flattened from above downwards. It is flattened. All right. So these are the features. Now, when you look at the anterior surface of the medial 2/3, it is actually smooth. Okay, and gives attachment to muscle. We will talk about the muscle in a bit. The posterior surface is also smooth, and it actually protects the neurovascular structure, and close to the medial end, it provides attachment to few fibers of the sternohyoid muscle. Okay, we will talk about the muscles, no worries. Then we have the superior surface. The superior surface is also smooth. The inferior surface, this is important, the inferior surface of the medial 2/3 close to the medial end actually presents a small depression. So there is a small depression on the inferior surface of the medial end. Inferior surface of the medial end. That is medial 2/3 close to the medial end. Okay, so this depression here is seen like a small pit. Okay, and what is attached there? There is a structure called the costoclavicular ligament. So what is this costoclavicular ligament? Through the costoclavicular ligament, the medial that is inferior surface of the shaft, that is medial 2/3 of the shaft of the clavicle, is attached to the first costal cartilage. So the first costal cartilage, and this surface is actually attached to the ligament called costoclavicular ligament. So I can actually show you this ligament when you just look at this animation here. I'm trying to so now when you look at the inferior aspect of the clavicle here, okay, so now you can see that there is a ligament here, this one right here. This is the costoclavicular ligament. So this ligament is going from the first costal cartilage to the inferior surface of the medial 2/3 close to the medial end. So this is the ligament I was actually talking about. So this is the costoclavicular ligament. So the superior attachment of the costoclavicular ligament is into a small depression that is present on the inferior surface of medial 2/3 of the shaft close to the midline. All right. Also in the middle third, okay, in the middle third of the inferior surface, there is a groove. This groove is known as the subclavian groove. Okay, this is the subclavian groove. As you can see, there's a small depression here in the middle part. This is the subclavian groove. That's where you have a muscle called the subclavius muscle is attached there. You can see little yellowish in color. That's the subclavian groove. So what else we have on the inferior surface? Inferior surface, one, we have a small depression. This small depression is actually for the costoclavicular ligament. Okay, it's known as the costoclavicular ligament. And also we have one more feature on the inferior surface of middle 1/3. So this inferior surface middle 1/3 is known as the subclavian groove. So what is attached in the subclavian groove is the subclavius muscle is actually inserted. Subclavius muscle is inserted. Now when we look at the anterior border of the lateral one third, coming to the lateral one third, okay, so the anterior border of the lateral one third, anterior border, it is actually sharp. All right, it is actually sharp, and we have a muscle attached there. So we will talk about the muscle in a bit. And the posterior border is also a bit sharp. Okay, the superior surface is smooth, a little bit rougher than the medial two third, and gives attachment to muscles. The inferior surface of the lateral one third also presents a special feature, the inferior surface. So the inferior surface presents a cone-like projection which is known as the conoid tubercle. Okay, we have something called the conoid tubercle. This conoid tubercle is present on the inferior surface, and it is very close to the posterior border. So conoid tubercle is present on the inferior surface of lateral one third of the shaft of the clavicle, close to the posterior border. There is another feature on the inferior surface of the lateral one third, and it is called the trapezoid ridge. This is called the trapezoid ridge. So the trapezoid ridge passes upwards and backwards from the conoid tubercle. So it runs this ridge actually, it runs upwards and backwards. Okay, from where? From the conoid tubercle. So this conoid tubercle and trapezoid ridges, these two together give attachment to the conoid and trapezoid parts of the coracoclavicular ligament. So what is this coracoclavicular ligament? It is attached between the coracoid process of the scapula and the clavicle. So that's the conoid tubercle and the trapezoid ridge. So maybe I can show you that as well. Now see here. So here we have the lateral end of the clavicle, right? The lateral end of the clavicle. When you look at the inferior surface, how do you know it is inferior? See below. So inferior surface, we have this projection here, this ligament here. This is the scapula. As you can see, this is the scapula. So this beak-like projection, you see, this beak-like projection is actually the coracoid process. So this coracoid process is attached to the clavicle, the lateral one third of the clavicle, through the coracoclavicular ligament. And this coracoclavicular ligament has got two parts, a conoid part and the trapezoid part. So here is the coracoclavicular ligament, this one, the coracoclavicular ligament. As you can see, it is attached between the inferior surface of the lateral one third and of the clavicle, of course, and the coracoid process. So that's the ligament. All right, this one. Now what else do we have in the shaft of the clavicle? So these are the borders and surfaces of the clavicle in the medial two third and lateral one third. Maybe I can actually show you the conoid tubercle in the isolated clavicle. See, this is the anterior surface, okay, and we are looking at the clavicle from the front. This is anterior surface, here is the posterior surface, this is the superior surface, this is the inferior surface. Now in the inferior surface, you see this projection here, this part here, this is the conoid tubercle, this one, this conoid tubercle. This part is the conoid tubercle, and also we will have something called the trapezoid ridge. Now here is the medial two-third with the subclavian groove, and here is the medial two-third, the inferior surface, this oval depression here, that is for the costoclavicular ligament. Here it is conotubercle for the coracoclavicular ligament. So these are the features, external features of the shaft of the clavicle, the two ends and the shaft. Now we will talk about the muscles attached to the clavicle. Now, what are the muscles attached to the clavicle? So different borders and surfaces have the attachments of various muscles. Now let us look at the muscles attached to the clavicle. Now let me add the muscles. Right, we have this superficial muscle here. This is the platysma. The platysma is actually a subcutaneous muscle that's found beneath the skin and extends from the pectoral region to the base of the mandible. Let us hide this muscle. Now we can see in the chest region, this muscle, highlighted muscle, is the pectoralis major muscle. This is the pectoralis major muscle. Now if you look at the attachments of the pectoralis major, that is the origin of the pectoralis major muscle, you can see that the muscle actually is taking place from the clavicle. Right, so which part of the clavicle? It takes origin from the anterior surface of medial half of medial two-third. So this can sound a little complicated, but if you understand it, it's very easy. So this muscle, that is pectoralis major muscle, takes its origin from the sternum as well as the clavicle. So the fibers taking origin from the clavicle are actually taking origin from the anterior surface of the medial half of the medial two-third of the clavicle. Okay, so let me put this in words here. So next, the headings we are going to discuss is muscular attachment. Any bone you take, it is going to be attached to various muscles. So muscular attachments of the clavicle. So what are the muscular attachments? So one muscle is the pectoralis major muscle. So where is the pectoralis major muscle attached? The pectoralis major muscle takes its origin. This is also important. So you have to mention whether it is origin or insertion. So there is origin of which fibers of pectoralis major? The clavicular fibers. Is the clavicular fibers, and where do they take their origin from? So from the anterior surface, basically from the anterior surface of which part of the shaft? Anterior surface of medial half of medial two-third. So we have two subdivision of the shaft, medial two-third and lateral one-third. So when you consider only the medial two-third, its medial half. So anterior surface of medial half of medial two-third of the shaft, the clavicle, basically gives attachment to the origin of pectoralis major muscle. Right. Next we have on the anterior surface. So let's continue on the anterior surface itself. So we have another muscle on the anterior surface here, but on the lateral one-third, right? So that's the deltoid muscle. So this is the clavicular fibers of the deltoid. They take origin from the anterior border of the lateral one-third, as you can see here, right? So this is the clavicular fibers or the anterior fibers of the deltoid. This is the then we have the middle fibers of the deltoid, then we have the posterior fibers of the deltoid. So the anterior fibers are taking origin from the anterior border of the lateral one-third of the shaft of the clavicle. Right. Now let us write this down. So that's the number one. So number two is the deltoid muscle. So the deltoid muscle is actually taking origin or insertion? Origin. Which fibers? It is the clavicular fibers, also known as the anterior fibers of which muscle? Deltoid muscle. Taking origin from which part of the shaft? From the anterior border of shaft. Which part of the shaft? Lateral 1/3 of the shaft, right? So anterior border, lateral 1/3 of the shaft gives origin to clavicular or the anterior fibers of the deltoid muscle. Now between the pectoralis major muscle and the deltoid muscle, there is a small gap left behind without any attachment, that is called that forms actually the base of deltopectoral groove. So there is something known as the deltopectoral groove. So lying in the deltopectoral groove is the cephalic vein. So the cephalic vein actually lies in this groove. So what is this deltopectoral groove? Let me show you. So here we can take a look at this. So here is the deltoid muscle on one side. The highlighted muscle is the deltoid. This is the clavicular fibers of the deltoid. This is the pectoralis major muscle. Now between the pectoralis major and the clavicular fibers of the deltoid. So pectoralis major, deltoid. Here is a small gap between the two. Right. So this is actually a part of the deltopectoral groove. So when you have the muscle, that is the pectoralis major muscle, goes like this, the pectoralis major, and we have the deltoid muscle going like this. Now here we get a triangular area. This is known as the deltopectoral groove. So you have to separate these two muscles from each other to find this deltopectoral groove. So here is the base of the deltopectoral groove, right? So this is the base of the deltopectoral, and then we have the two sides. One side is formed by the pectoralis major muscle, the other one side is formed by the deltoid muscle. Here is the apex. So this actually contains the cephalic vein. The cephalic vein passes into the deltopectoral groove. Right. So between the pectoralis major and deltoid muscle, there is a small part of the clavicle which forms base of deltopectoral groove, which is a triangular interval between the pectoralis major muscle medially and the clavicular fibers of the deltoid laterally. The deltopectoral groove contains few lymph nodes, and the major content of deltopectoral groove being the cephalic vein, which is one of the veins that drain venous blood from the upper limb. So that's the anterior surface. Now coming to the superior surface. So what structures we have on the superior surface of the clavicle? So superior surface. So superior surface from its medial half. So medial half of superior surface provides origin to the clavicular heads, the clavicular head of this is another muscle, sternocleidomastoid muscle. Maybe I can show you this muscle, so it'll become easy for you to remember. Well, my hands are oily, that's why I'm finding it difficult to close the windows. Okay, anyway, so now the superior surface, going to the superior. So this is the anterior surface of the medial two-third and the anterior border of the lateral one-third. We already discussed two muscles are the pectoralis major and the deltoid. Now the superior surface, here you can see this is a muscle that's called the sternocleidomastoid muscle. The sternocleidomastoid muscle has got two heads. One is the sternal head that takes origin from the sternum, and a clavicular head that takes origin from the clavicle. So we can see that the medial half of the superior surface of the shaft, that is medial two-third of the shaft of the clavicle, provides origin to the clavicular head of sternocleidomastoid muscle. So the two heads are there, and the heads unite with each other and they insert to the mastoid process. Here is the mastoid process. Don't worry about the mastoid process because it's found in the temporal bone. So another muscle to add, we have another muscle That is, the third one here is the sternocleidomastoid muscle, right? So the sternocleidomastoid muscle from the superior surface. Sternocleidomastoid, this one, sternocleidomastoid muscle, that's from the superior surface. Now what happens in the lateral one third? In the lateral one third, the deltoid muscle taking origin from the anterior border also covers the anterior half of superior surface of the lateral one third. Now coming to the posterior surface. So the medial two-third of the posterior surface, medial two-third of the posterior two-third, medial two-third of the shaft of the clavicle actually is going to protect the neurovascular structures. There are no muscles attached there except a few fibers of one muscle. Okay, so when we look at the superior surface, the major muscle that we see here is the sternocleidomastoid muscle. Now when you look at the posterior surface of the medial two-third, we see a muscle here. This muscle here is the sternohyoid muscle. This is the sternohyoid muscle. This actually takes origin from the posterior surface of the manubrium of the sternum, but a few fibers will take their origins from the posterior surface of the medial end of the clavicle. So from the anterior surface we have the pectoralis major, superior surface we have the sternocleidomastoid, and posterior surface we have few fibers of sternohyoid muscle. Above it is going to attach to the hyoid bone. So it basically goes from the sternum to the hyoid bone. So that's just sternohyoid. So the posterior surface of the shaft close to the medial end provides origin to few fibers of sternohyoid muscle. Now what about the lateral one third? The lateral one third is has a border here, that is a posterior border. This gives insertion to the trapezius muscle. So the posterior border of the lateral one third provides insertion to trapezius muscle. So the trapezius muscle is a diamond shaped muscle. In this animation you can see only one half, that is the left half of the trapezius muscle. There is a exact mirror image on the other side, that's the right half of the trapezius. So these two together gives it a trapezoid like appearance. So basically we have the trapezius muscle getting inserted to the posterior border of the lateral one third of the clavicle. All right, so here you can see this is the trapezius muscle of the right side. So it has got three groups of fibers: upper group, middle group, and lower group. These three together is one trapezius. It is trapezius muscle of one half, right? So the posterior border of the lateral one third gives attachment to, that is actually insertion to. So the posterior border of the lateral one third gives insertion to the fibers of trapezius muscle. Trapezius muscle is inserted. All right, so apart from these muscles, what are the muscles we discussed? Pectoralis major from the anterior surface of medial half. Then we have the sternocleidomastoid from the superior surface of the medial half. Then we have the sternohyoid close to the medial end from the posterior surface. Then we have from the lateral one third anterior border we have origin of clavicular fibers of deltoid. Posteriorly we have the insertion of the trapezius muscle. Apart from these muscles, there is one more muscle that is known as the subclavius muscle. So the subclavius muscle is actually inserted to the subclavian groove. So this subclavian groove is actually present on the inferior surface of middle one third of the shaft. So let me show you where exactly is the muscle. So see, on the inferior surface, we should look for this muscle on the inferior surface. So let me remove the pectoralis major muscle. So when I hide the pectoralis major muscle, I can see there is a small muscle here. This one, this highlighted muscle is the subclavius muscle. See that? This is the subclavius muscle. The subclavius muscle has its origin from the first costal cartilage and is inserted to the subclavian groove, which is present on the inferior surface of middle 1/3 of shaft of the clavicle. So that's the muscle I was talking about, the subclavius muscle. So these are the muscles that are attached to the clavicle. Right, so now if I ask you to list the muscles attached to clavicle, one is the pectoralis major muscle, which is attached on the anterior surface, and then we have the sternocleidomastoid. So the sternocleidomastoid muscle, which is attached to the superior surface. Then we have the sternohyoid muscle, which is attached on the posterior surface. How much of the surface it is covered is also important. Okay, I've already explained it. So these many muscles. In addition, we have on the inferior surface, we have the subclavius muscle. So on all surfaces, anterior, superior, posterior and inferior surface. So inferior surface, we have the subclavius muscle. So these many muscles are actually coming from the medial two-third of the shaft. Okay, so these many muscles from the medial two-third of the shaft, not entire medial two-third. Okay, you should remember how much of the medial two-third and which surface of the medial two-third. From the lateral one-third, we have two muscles. One is on the anterior border, which is the clavicular fibers of deltoid, and on the deltoid, okay, and on the posterior border we have the insertion of the some fibers of the trapezius muscle. So these are the muscles attached to the clavicle. Now, which is the weakest point of the clavicle? So coming to the applied anatomy of the clavicle, applied anatomy. So in applied anatomy, we have to discuss the fracture of the clavicle. So the clavicle actually undergoes a fracture at the junction between the medial two-third and the lateral one-third, because the curvature changes here. As you can see, the curvature of the clavicle changes at the junction between the medial two-third and the lateral one-third. So because the curvatures change, okay, so it happens to be the weakest point, right? So this is the weakest point here, junction of medial to the lateral one-third. Then there is something called cleidocranial dysostosis. Cleidocranial dysostosis. What is dysostosis? There is something wrong with the ossification of the clavicles. Now we know that the clavicle is a bone that is partly developed in membrane and partly developed in cartilage. So it is a membrano-cartilaginous bone. So most of the clavicle develops in the membrane, most of it, and small part of it develops in cartilage. So it is a membrano-cartilaginous bone. In this condition called cleidocranial dysostosis, we have the deformities in the formation of the clavicle and the bones of the skull, because some bones of the skull, especially the skull vault, the bones of the skull vault, they are formed by membranous ossification. So membranous ossification. So the part of the clavicle that is formed by membranous ossification is also not formed. So dysostos or not properly formed. So this is called cleidocranial dysostosis, in which there is some deformity in the formation of some bones of the skull bone and the part of the clavicle that is developed from membrane, right? So the cleidocranial dysostosis. So when the clavicle is absent, it may be associated with the absence of pectoralis major muscle also. So the pectoralis major muscle, sometimes associated absence of the pectoralis minor is also observed in a condition called Poland syndrome. So when the clavicles are absent, the two edges of the shoulder can be touched. They can be approximated or even touched. So Poland deformity is when the pectoral muscles are absent. Okay, pectoral muscles are absent or not formed. So that's about the the applied anatomy of the clavicle. Next, let us talk about the peculiarities of the clavicle. So I started with the peculiarities, and I lost it somewhere. Anyway, we'll come back to the peculiarities. So it's a long bone. Okay, no doubt. The clavicle is a long bone. The long bone is any bone that is having two ends and a shaft. So the clavicle also has two ends and a shaft. So it is a long bone, but it is referred to as a modified long bone. So why it is referred to as a modified long bone? Because it is developed partly in membrane and partly in cartilage. So it is a membrano-cartilaginous bone, membrano-cartilaginous bone. And being a long bone, it does not have a medullary cavity, right? No medullary cavity. So we know that all the long bones have medullary cavity in them, but clavicle, being a long bone, does not have a medullary cavity. Also, being a long bone, clavicle has got two primary ossification centers. So how many ossification centers are found in long bones? So long bones will have only one primary ossification center, except for the clavicle. So it's a peculiarity of the clavicle that being a long bone, it has got two primary ossification centers. And the clavicle is the first bone to start ossification. Okay, first bone to start ossification, and it starts to ossify between 5th and 6th week of intrauterine life. Okay, and also it is the last bone to complete ossification. So when does it complete ossification? Usually 23 years, in females 1 or 2 years before, and it can take up to 31 years for the clavicle bone to completely ossify, right? And other peculiarities of clavicle is that it is subcutaneous throughout. Between the attachments of the muscles, the bone is subcutaneous throughout. So that is one of the peculiarities. And also it is the only long bone that is placed nearly horizontally in our body. Okay, it is placed nearly horizontally in our body, and it is the only bone that is sometimes pierced by cutaneous nerves. So which cutaneous nerve will pierce the clavicle? The intermediate supraclavicular nerve. Intermediate supraclavicular nerve will pierce. Not always, often it pierces the shaft of the clavicle. So these are the different peculiarities of the clavicle. I want you to add more peculiarities to this list. Now, one more last thing, how to determine the side of the given clavicle. So it is the side determination and anatomical position. Okay, so what is the anatomical position? So in order to determine the anatomical position, we should know about the ends. Okay, the two ends of the clavicle. What are the two ends of the clavicle and how you should align it? Okay, so two ends, it has got a medial end and a lateral end, so you should hold it accordingly. Medial end should be medially, lateral end should be laterally. That is how you hold it. Then the surfaces, you also have to look at the surfaces. So the inferior surface, okay, close to the medial end, the inferior surface, what is the feature there? Close to medial end, it presents a small depression, right? It presents a small depression. This depression should be inferior. So this depression is for the attachment of costoclavicular ligament. Similarly, in the same inferior surface, this is in the medial, you will find it in the medial 2/3. In the lateral 1/3, you will find this conoid tubercle. This conoid tubercle is also on the inferior surface, but it is closer to the posterior border. So also the curvature, also you have to take care of the, look at the curvatures of the shaft. So you should hold it in such a way that the medial 2/3 is convex anteriorly. Okay, so all these points when lined up together will help you identify the side of the given clavicle. So side is either left or right. Okay, now look at this clavicle here. So this is the anatomical positions. What is the anatomical position? The clavicle is placed nearly horizontally with its medial end directed downwards and slightly forwards. Downwards, forwards and medially. The lateral end is directed upwards, laterally, upwards and laterally. Okay, this one. And also look at the curvature. The curvature of the medial tooth should be convex anteriorly. So should be convex anteriorly. And on the inferior surface, we see a depression here. See, exactly on the inferior surface, we see a small depression here. That is for the attachment of costoclavicular ligament. Similarly, in the lateral 1/3, we find this tubercle, this triangular projection known as the conoid tubercle. It should be placed inferiorly. So this is how you determine the side of the given clavicle. So that's all I wanted to tell you about the clavicle bone. So clavicle is actually an important bone. So to summarize, in this session I discussed the clavicle under various headings. First, we started with the term, the pectoral girdle, and then I told you the functions of the clavicle. Then we discussed the external features such as the ends of the clavicle, then the shaft of the clavicle. We divided the shaft of the clavicle into medial and lateral parts. Then we discussed the external features of each part. That is, medial tooth has got 4 surfaces. The lateral one consists of 2 borders and 2 surfaces. And then I told you about the muscles attached to the clavicle. Then we discussed how to hold the bone in anatomical position to determine the side of the given bone. And we also discussed the applied anatomy of the clavicle. So what happens following the fracture of the clavicle? It is usually fractured at the junction between the medial tooth and lateral 1/3. So this is because the ossification, so like I told you, the ossification of the clavicle begins is between 5th and 6th weeks of intrauterine life. There will be 2 primary ossification centers. These ossification centers will meet here at the junction. Okay, and the secondary ossification center, there is one secondary ossification center that is that appears during the late teens and early 20s, appears for the medial end of the clavicle. Well, the fusion actually between the the secondary and the primary ossification centers will appear towards the end of the teen and early 20s. So the secondary ossification center for the medial end of the clavicle, there's usually one secondary ossification center. The secondary ossification center sometimes, very rarely, appears in the lateral end, is not usually present. So the secondary ossification center, usually there is one secondary ossification center that appears about 18 years, meaning towards end of the teen or early 20s. And this will start fusing with the primary ossification, that is the shaft, around 21 years. And it completes by 23 to 25 years. And it can extend up to 31 years. So that's about the clavicle. Thank you very much.